Hey guys, welcome to another Double Tap on YouTube. I am Stephen Scott. I'm here at the Zero Project Conference in Vienna, and we've been catching up with some pretty cool companies, one in particular called Lumen.
Sure, my name is Cornel Amarei, and I'm the CEO and founder of Lumen, where we build glasses that empower the blind to live a better life.
Well, first off, thank you so much for coming over here to see us at Double Tap. You were at CES this year, right?
We were also at CES, yes.
Yeah.
We were at CES, we were doing demonstrations over there. It was a great experience. It was a very tiring experience. This is definitely a much smaller crowd over here, but still very excited to be here as well.
So tell me about your product. What is it?
So I want to start with the problem, basically. The problem which we're tackling is that the guide dog is a great solution, but it has a couple of drawbacks. It costs a lot to train a guide dog. And the second one is a lot of responsibility to take care of a guide dog. It's a lot of effort to take care of a guide dog. But what the guide dog does, it does great. So our question was, can we replicate what the guide dog does in technology without the drawbacks that make the guide dog a non-scalable solution? Because if you think of a guide dog, you have over 100 million people who could potentially benefit from a guide dog, but there are only 28,000 guide dogs in the entire world. So this is what we do at Lumen. We basically created the Lumen glasses, which they use self-driving technology to do what the guide dog does without the drawbacks that the guide dog has. But to give an analogy of what we actually do, if you think of a guide dog, you can ask a guide dog not to guide you in general or to take you to a specific object. And the guide dog will do this by pulling your hand, avoiding you from obstacles, keeping you on the sidewalk, stopping you at crossings, stopping you at stairs, etc. You can ask the Lumen glasses the same thing, and they will do the same, but rather than pulling your hand as the guide dog does, we actually pull your head. So it actually feels with our haptic vibration interface how something is holding your head and how something is pulling your forehead in a direction you have to go. It's immensely intuitive. You'll be able to test very soon. And we have testing with over 300 blind individuals. We are in clinical investigations. We're putting the product on the market as a medical device at the end of the year. We have been working on this for 3 years. A team of 50 scientists and engineers part of this company at this point. And we just can't wait to put a product on the market and to help people. And maybe to go a bit to the beginning, the reason this company exists is because I was born in a family of people with disabilities. I'm the only person without a disability in my family. And after a career in the automotive field where I worked on self-driving and electric mobility and everything, I decided to take that technology and to actually do something which is much more pedestrian, but really empowering lives of people.
Wow. I don't know where to start with this one, honestly. There's so many questions I have. Right, I'm going to let you have a question here, Shaun, because I will start asking a million questions.
We'll come back to pulling off your head to guide you. We'll come back to that. That's really interesting. But I'm interested in the self-driving. You said you came from that sector before anyway, and that led you here. And we're seeing a lot of products that are using sort of that technology of LiDAR, 3D mapping, and cameras. Also good. But when it comes to something like navigation and getting around for us, it's how you can map the environment, but how do you get that information across to us? Is it an audio feedback? Is it haptic like you're using there?
Sure.
How do you deal with that information and getting it back to the actual user of the device?
Sure. So the first thing which we do differently, since the 1950s, people have been trying to represent visual information in a non-visual way. So, you get audio where there are obstacles, you get vibrations where there are obstacles. The problem with that is the world is simply too complex. You will get to sensory overload way too quickly. Because, the moment you have more than 2 obstacles, you can no longer in computed sound or vibrations really understand what's happening fast enough. So what we said that we're going to do 100% differently is we will not go that bad. However, we looked at the guide dog, and the guide dog is not barking when there's an obstacle. No, it guides me around it. And this is what we did. But rather than having like a big thing which has to walk next to you, we decided to scale it down to a wearable, to something which you can comfortably wear. And after a tremendous amount of tests, we determined that the head region is the safest and the best region to actually have this kind of feedback. So what we do with haptics is that rather than pulling your hand, rather than feeling like something is pulling your hand, we actually pull your head around obstacles, around everything. It's immensely intuitive. The problem is that in words, I didn't find the right way of saying it. I never found the right way. But the moment you'll test, you can explain how it feels and how you can use those vibrations to guide you. Now, we have audio, we have text. You can actually speak with the device, and the device will answer you. You have an audio. You have a button menu with with audio, sorry, you have a button audio menu. You have ways for which you can interact from your smartphone. So, for example, if you want to go to a more like faraway destination, like say you're here in the Vienna UN, but you want to go in Stephansplatz in the center of Vienna, you can actually go on Google Maps, search for Stephansplatz, press share, and you could actually share to the device, to our glasses, and they will take you there. They will guide you. They will find you that tram station. They will help you get in the tram, and they'll help you get off over there. So It's basically everything that a self-driving car will do, but specifically on the feedback, we use audio and haptics in a new and intuitive way.
So I have heard a lot over the years about these kind of products. Mm-hmm. I hear about the replacement for the smart cane, the smart guide dog, the replacement of the guide dog. Is that what you're selling here, or are you selling this as an additional? So to those original mobility ways.
We have nothing to do with the smart cane, or with the white cane or with the smart cane. People can still use the white cane together with our technology, even if technically speaking you no longer need it. We actually, the device can detect that you're using a white cane, and it can ignore it.
Would you recommend people using this product as opposed to using a cane?
I do not. We do not compete with neither the white cane, neither the guide dog. Our purpose is not to replace the guide dog. There are way too few guide dogs in the world, so we do not want to replace the guide dog. What we want to do is to bring the same benefits as the guide dog does, but to the other basically 39 plus million blind individuals who cannot have a guide dog. That's what we do. So for the people who have a guide dog and who can live that lifestyle and can take care and everything, then they have the solution. Then we're not for them. We're for the other people who do not have a guide dog because they do not want to have one, because it's a complicated lifestyle, because it's too expensive, etc. That's what we want to do. In terms of the white cane, technically we can replace the white cane. Practically, we don't necessarily want to. I think that you still have some situational awareness which you understand with your tactile feel, and the device will basically do what the guide dog does. And there are people who use both the guide dog and the white cane, so it's not they're not mutually exclusive.
And where is it at the moment in terms of? I mean, you're saying that you're going through the process of getting this clinically agreed, and all of that. How is it progressing in that way?
I mean, it's absolutely great. I mean, we have tested with over this point 300 blind individuals. And we are finishing everything and all documentation to release it as a Class 1 medical device end of the year. So basically, this will be a medical device released end of the year in our country, but then very, very quickly we're going to scale it to other markets as well. So next year we're discussing about a worldwide device as a medical device.
Wow. So what sort of objects does it detect? I mean, in a self-driving car, obviously there's certain things you're looking out for. Has that been tweaked for specifically this use case?
Yes, I mean, it's built from the ground up specifically for the pedestrian use case, and there are a lot of differences. I mean, for example, a car has a constant height, plus minus suspension. Humans, they sit, they go up, they do a lot of crazy things, which a self-driving car does not. But to give you a bit of context, we do, I think, three important things, which I can, more than three, but three important things. The first thing is that we understand the world geometrically, so we understand what is the ground and all the obstacles above it or below it. However, that is definitely not enough. Why? Just because a surface is flat, it doesn't mean it's safe to walk on. An example which I love is a lake. A lake is perfectly flat. It doesn't mean you can walk on it. And I'm looking forward for all the other technologies which can guide you towards the lake. Then that's where we add the second level. We use basically the best artificial intelligence model in the world, which we have designed on our own data, our own architecture and everything, in order to understand that this is a sidewalk, this is a road, this is a crossing, this is a lake, this is a puddle, this is mud. So all of the surfaces, which most of them look exactly flat, it doesn't mean you can walk on them, but we detect all of those and we integrate it into what the device understands. And the third thing which we do is that we compute safely walkable paths over 100 times a second so that you can avoid all the obstacles, so that you can stay on the safe walking terrain, etc., be it to the sidewalk, be it indoors, etc. We do all of that, and all of that combined is what brings the basic guiding functionality. On top of the guiding functionality, we have a lot of other things which are helpful. For example, detection of objects which are of interest. Chairs or doors or stairs. Buses is something which we're doing now. Basically, very, very soon, I think we're going to finish this. We will be able to integrate public transport in the device. So if you're here and you want to go to the city center of Vienna, the device will take you to the tram station. We already tested this. And then you will be able to, will help you to walk into the tram, and then it will help you get off the tram and everything. So all of those things are also being integrated, and those are on top of the basic guidance which the system does. We also do reading, also do other functions which are, the moment we have a head-worn wearable, you can do a lot. But the basic functionality, which is the most important for us and is related to our purpose of aiding mobility, is replicating what the guide dog does in the basic guiding situation.
And what about nighttime? You know, can this thing see at night?
It can see at night, but to give a disclaimer, at the beginning we are releasing it with daytime use, so it will work sunlight. How do you say? We will work from sunrise to sunset. This is our target now. It does see very well in the night. We haven't certified it for the night yet, but we're getting there soon.
And this is, it's not AI driven, but it's AI's behind it.
It's AI powered, yes.
Yeah, and that is growing all the time. The capability of AI is growing all the time. So, do you think we're at the worst this can ever be at this stage? You know, it can only improve, it can only get better, it can only get more capable.
Yes, so
as a device.
It will get even basically we're a software startup, so we do design the hardware with an external provider of hardware services and everything. But we're a software startup, so the device gets over the air updates and it becomes smarter and smarter and smarter.
Which is what a lot of these companies are doing now, right? You're going third party for the company for the hardware, but actually a lot of the software is what you're working on, what you're devising. And you say you've worked with over 300 people who are blind in your country.
Not only in our country, so all over the world, but most of the people are from our countries. We do most of the experimentation there for logistic reasons.
Right.
But most of the people are from my country of Romania, Eastern Europe. But we have tested all over the world. We have actually tested the device in 20 countries at this point.
Well, I think we've seen 3 or 4 people going up and down in front of us today, haven't we? So that's what
you're going to test it later, right? You're going to test it.
Hopefully I'm going to test it later on. So
my colleagues are waiting for you, so no worries about that.
Oh, fantastic. Can't wait.
Yeah, it's really, really interesting. You know, your company name comes up a lot, and it's interesting because there are a lot of companies over the years that have tried to do what you're doing, and they either fall by the wayside or they just don't quite capture the imagination. Yours seems to be capturing. You know, CES, for example, a lot of people are excited about it. A lot of mainstream publications were talking about your product.
That's true.
And I know some of that is just interest because it's different. But of course, you know, it is a device which can really make a difference to us if it works properly. You're saying it's going to be out by the end of the year as a Class 1 medical device in Romania?
It's European Union, and
in the EU.
For FDA approval in the United States, we're going to target next year, beginning of next year.
Okay. And how will this be rolled out? Is your intention for it to be rolled out as a medical device, or people can buy it?
So basically, what we do in Europe, point of this company is to help people. This is why we founded the company, to help people. And for Europe, we're working with all the possible reimbursement funds in each country individually, such that we can get this at either a very low cost or for free for people with visual disabilities.
Well, that works in your favor, doesn't it? Because it allows you to cover your costs for R&D, and it allows us to get access to the product.
True. We're searching the same for the United States. So we're exploring the United States market and how it works and how reimbursement works over there, how subsidies work over there, the dimension of the out-of-pocket market and everything. The point is the same, to help as many people as possible. We have 3 generations of the product already planned. The first one is indeed for markets like Europe and the US, but the second generation, which is coming roughly 3 years, that generation is going to be, as technology advances, better, cheaper, faster, lighter, etc., and it's targeted for more markets. And by the 3rd generation, which 2028 is scheduled, we hope to go into the lower income markets when the device will be much cheaper, etc. So we're continuously working on tackling more and more markets with a device with a price point which is attractive to more and more markets, depending on the reimbursement, depending on the subsidies in each market. But to get back to the US, in the US we're now working with several partners, and we want to enhance that partner network in order to bring it to the market, in order to see how we can maximize the amount of reimbursement and subsidy that a person can get in order to purchase our technology, and to basically help as many people as possible. And we do need help. We need help towards helping as many people as possible.
But with all those barriers, you face probably the biggest one, which is trust. Because if you give me a device like this and say, and I know you're not saying it can replace the white cane, although potentially it could, but I think I'd be very cautious of ever letting go of my white cane. I don't know about you, Sean, but I would want my white cane with me.
No.
You want to get rid of it?
No, I'm just saying that this is, if it delivers and performs as well as you say it can, could potentially be another mobility aid. I mean, the white cane and the guide dog so far has earned our trust, right? After years and years and years, we trust on that, and we know we can rely on it.
Well, it's the intelligence of the dog, and it's the simplicity of the cane, I think, which is the winner. You know, you can't really go wrong with a stick.
That
right?
is true.
It's not going to break down. It's not. Well, it doesn't need a software update. You know, it doesn't. You just use it.
You don't need to charge it.
It can fall apart on you. That's for sure. Mine
yes.
has. Yeah, that's happened. But I think that's going to be the challenge: is getting people to trust it. So, what are you doing there? Because in your trials, that must come up. People must be nervous when they put this thing on.
Well, the thing is, a very good indicator I had a year ago, a very good indicator about that. 1 year ago, we were doing some absolutely random testing in Lisbon, in Portugal. And I was there. My 2 members of my team were there. There was a visually impaired individual which began testing, and he went away like 150 meters or like 400 feet from us. And I was looking at my team standing somewhere else, just chatting and laughing. And that's the moment when I realized, okay, we are there. Because if my team 100% trusts to leave this device, then that was 1 year ago, to 100% leave this device to be operated with a person which only experimented for 5 or 10 minutes, then we're going in the right path. No incidents ever happen with testing the technology. Now, what we are doing specifically on that in order to grow that trust and everything, we are recommending, heavily recommended for the individuals which use our device to also use the white cane. And we actually designed the device to detect that white cane and to ignore it as an obstacle because, having a white cane in front of it, that would be an obstacle. Yeah. And the way we do that is, I will not really say how we do that because we're still patenting it. But it's really, really interesting. Just such a simple thing, just to use your white cane together with a technology which is designed to keep you away from obstacles. It's technically incredibly complicated to take care of not detecting that as an obstacle. Yeah. But we're recommending people to still use their white cane because it still gives you the context of understanding a bit better what the device is doing. We are working on in the training. So the device will teach every user how to be used, and will publish new lessons in the device so that you can experiment more. And even if the device, for example, computes a way which, it takes you away from obstacles from far away, and it computes like even in some cases 30 feet in front of you, when you still use a white cane, we're looking at opportunities that we can actually bring you more closer to the obstacle so you can understand where the obstacle is and how the device takes you around it. So we're basically letting the device, together with the technology which you know how to use well, which is the white cane, to earn your trust by understanding what it does. So this is one of the things which we do. No incidents have ever happened. We had tremendously absolutely incredible feedback from our technology. There are still points which are improving. We're always making it smaller. We're always making it better. We're always increasing the battery life and etc. But no incidents have ever happened. From the way things go, probably no incidents will ever happen. Multiple redundant mechanisms taking care of this. Everything we do in self-driving, we do on the device as well. So there are at least 3 redundant mechanisms taking care of you in the same time. Each one independent. It will never happen, but if a bullet goes through one of the batteries, you will still be safe. The device will still be able to not guide you anywhere where it's difficult. So it's designed by that amount of technical scrutiny and everything.
Well, I know Sean's looking forward to trying it out. We're going to get you over to try it out, and we'll hear that a bit later on. But for now, thank you so much for coming on. Tell people how they can follow your progress and what you're doing.
There are 2 options. .lumen.com. That would be our website. Or just go on Google and search .lumen, and you will find our social media. You will find our website, and we try to be roughly active on social media and everything. We really want to share the journey of this.
Brilliant. Good luck with it.
Thank you so much, guys.
Okay, so that is the news about the tech, but what's it like to try it out? Well, Shan Priest has been off testing out Lumen on the move.
Yes, thanks, Stephen. So I'm here ready to try the Lumen device, and someone's with me now. Who's here?
Yeah, I'm Octavian. Nice to meet you.
Nice to meet you.
So I have the device ready. So
okay,
I'm going to help you put it on.
Now, I was told to throw my cane away. I didn't need it, so I'm trusting you.
So
wow. Okay.
Let me make sure it's good enough. It should be snug and comfortable. It shouldn't be too
I've got a funny shaped head. Okay.
Yeah.
That is. So maybe just describe it a little bit. So it's like a VR headset, but resting across my forehead and around the back of my head. It's not too heavy, but it's got some weight to it. But this is a prototype still?
Yeah, exactly. So this is a prototype. The production version is going to be about 30-40% lighter.
Okay. So how does it work?
The balance is going to be, it's going to be a lot more balanced, so you won't feel the weight.
Okay.
So it's going to be even more.
It does feel straight. It does feel like there's some sort of weight to my head. It's almost like it's pulling me right now, but it's not on. I think I'm imagining that.
Yeah.
Okay, so how does this work?
It's going to be pulling you in just a bit.
Okay.
But it's perfect. So we're going to do, we have like a whole tutorial section.
Right.
When you first take out the device out of the box, it's going to basically instruct you how to use it. So everything from buttons, voice commands, guide mode, and take me, basically everything you need to know about the device. We're going to skip over that right now. I think it makes sense. So we're going to go straight to the haptic feedback.
Okay.
So you're going to feel basically the guidance on your forehead. Get
Right.
used to it.
Okay.
Move around a bit. When you're comfortable, we're going to go to guide mode,
Right.
which is basically mimicking what the guide dog does.
Okay.
So it's going to avoid your obstacles and try to take you the way you're pointing the device.
Right.
Right?
Okay.
Does it make sense?
Yeah, let's
Perfect.
try it out.
So
I'm ready.
I'm going to go through the menu. And just so you know what I'm doing, can you
Oh, sorry, yeah.
have your hand? Yeah.
Of course.
So if you use your thumb, there's 3 buttons about over
Okay, 3 buttons on the
Right.
underside towards the front right temple.
Yeah.
So
that's one way of operating the device. The
Okay.
other way is through voice commands. So everything you can do with the buttons, you can do to the voice command. So you don't need to use your hands at all.
Gotcha.
So just tell it, hey Lumen, guide me, or hey Lumen, do the tutorial, whatever, right?
Right.
We're going to use the buttons for now, just because it's easier for this.
okay, so every time you're pressing that button, I'm hearing the guide me.
Yeah, I'm going through the menu right
take
now.
me, yeah.
We're going to go through to the tutorial section. Perfect.
Okay,
Complete tutorial, don't want to do that because it's a bit long for this.
we got time.
Buttons.
No, we haven't.
So haptic tutorial.
Okay.
And yeah, just listen to the lady and she's
All
going
right.
to tell you anything you need to do.
Haptic feedback is one of the glass's 2 methods to interact with the user.
Okay.
On your forehead, there are 9 motors that will intuitively vibrate to guide you.
There's 9 motors on my forehead.
This is the one on the left.
That's scary.
You didn't know that.
This is the one on the right.
Oh.
This is the one in the middle.
Oh, wow.
And here's
Okay.
the sweep.
Right, so I'm feeling little vibrations all on my forehead right now. That is strange. They're not really strong, just like,
Did you feel the vibrations?
yes.
If
So,
not, please
oh.
adjust the glasses and press the middle button.
so she's asking me if I felt that.
Press any other buttons to continue.
Yeah. So it's really important. This is basically the main guiding, the main feedback you're going to feel
Okay.
when being guided by the system. So it's really important that you feel them right. If
Right,
not,
yep.
you can adjust the Did you feel them?
I did feel them.
Okay, so let's listen to. So press any button
So-
to continue. I press the button.
There
Let's
might
go
be
next.
situations in which you have to be notified about the dangers around you or if you have reached your destination.
Okay, so now she's telling me
This is how your forehead will vibrate if there is an emergency.
if there's an emergency, I will feel this vibration. Okay, so it's vibrating on
You have finished
both
the
sides of my
haptic
forehead.
tutorial.
So that's emergency stop, basically.
Yeah,
Okay.
exactly. So you're going to feel that. We're going to test that later on.
Oh, good.
You're going to feel it. For example, if you get too close to an obstacle,
Yes.
I'm going to simulate that by just raising my
Jumping
hand
in front
you.
of me,
Yeah,
okay.
or you can cover the cameras if you can cover the system.
Right.
It's going to tell you stop. There's possibly danger. There's possibly like a dangerous situation. There's an
Okay.
obstacle in front of you. Stop and try to follow the feedback, right?
Perfect.
So we're going to test that.
Okay.
So next up, let's be a bit more dynamic with the vibrations. So let's do the head turner part.
Voice tutorial. Head turner.
Head turner.
Perfect.
Let's
Again,
bring some
listen to
fun
the
to
lady.
the table.
Let's bring some fun.
Tutorial.
Oh, no.
Learn to work towards the vibration. Your goal is to keep the vibration in the middle of your forehead.
Ah,
You should
right.
only rotate
Okay,
and
so
move around.
now I've got to turn my head to keep the vibration in the middle of my forehead.
Confirm that you are standing up by pressing any button to continue.
Okay, now press any button to confirm I'm standing up,
Can do it.
The
which I'm
motors will
doing.
Start vibrating. Remember, you should turn your head until you feel the vibration in the middle of your forehead.
So a lot like 3D audio with something like Soundscape, where you can
Congratulations.
use head tracking. It's using the same thing with vibration.
Try to reach
Exactly.
it again.
Yeah.
So now it's vibrating here, so I'm going to turn to the right, and now it's like there's a wasp crawling across my forehead. I don't know if that's good. It's something you want to use in your PR.
Try to reach it again.
Yeah.
Oh, okay. Now it's a pulsating
Exactly.
vibration. That is so strange.
You are doing good.
When you feel the pulsating vibration,
Way of feedback.
Yeah.
you found all 3 goals. Perfect.
And to keep you safe from the potential
Let's lady,
dangers.
Sorry.
the lady finish.
You have finished the head turner section of this tutorial.
I finished the head turner.
That's it.
Okay.
That's basically the fundamentals of how the system will guide you.
Okay.
You're going to need to do exactly the same thing when being guided by the system. So keep the vibration in the center.
Got you.
If you don't feel it, or if it's to the left or to the right, to the left, to the right,
Well done.
your goal is to your goal is to rotate around until it's in the center.
So the center is the safe path. Is
Exactly.
that what
So
we're aiming for?
The
Okay.
system will always inform you of the safe path to go
Yeah.
with the haptic feedback. So the vibration basically indicates to you where the safe path is, right?
Right.
So that's it. Yeah.
We got to trust it. Okay, let's try it out. With no cane.
No cane.
I'm quite
It's gonna be
nervous. We'll see.
You usually use a cane, right?
Yep.
Perfect. You have a guide dog as well?
No.
Guide me.
So we're
Guide
gonna
me.
activate the guide me mode, which is again mimics the guide dog. Basically, you tell the system where you want to go by pointing it in that way. So right now, you're telling the system you want to go straight ahead.
Yes, I do.
cool.
There's no vibration at the minute.
No, I didn't activate this.
Oh, okay.
I was just explaining. But less explaining.
Indoor mode?
Indoor mode, perfect. Because we're indoor.
We are indoor. Oh.
Guide me activated in indoor mode.
Okay, narrow.
Yeah, you heard narrow. So
Right, I'm feeling like these little fluttery vibrations here on the left-hand side.
yeah. When you feel the pulsating vibration, that means you need to turn a lot that way.
Ah, right,
So
okay.
90 degrees or
So
180 degrees.
I'm going to turn that way, and it's now in the center-ish.
Yeah, it's probably going to move around.
Yes, it does.
Because
It moves
there's
around.
lots of people moving around, and
Right.
it always computes where the safe path is.
Okay.
So, but that's it. Just follow it, and
So if I walk this way, now it stops. Now it's that way.
Guess why?
I'm gonna be.
What? Yeah.
I'm gonna be a moving, annoying obstacle.
Okay.
Just to get a sense of how the system reacts, right? So right now I'm talking, so you can hear.
Yes.
You can feel what the system is doing based on where I move.
Oh, hang on. That suddenly switched over there.
Yeah. If I come this way, it's gonna switch again. Right?
Yeah. Oh, hang
Is
on.
it that way or the other way?
That way.
Yeah.
I'm back.
Right?
Everybody is surrounding you right now. So let's
Oh, that's right. Okay. I'm trying to figure it out.
You can probably.
Okay. Yes.
I mean, you can go wherever you want. As long as you follow the feedback, you're safe.
Right. It's so strange.
Guess why?
Why?
Because I was right in front of you.
Okay. Every time. Oh, I totally get that. It's surprising how quickly you get used to it.
Yep. In 2 minutes.
Yeah. No, that is very good. I've got to say, yeah, I'm quite impressed with that.
Well, we aim to please.
Very good. Thank
Try the
you.
emergency feedback and cover the cameras.
Oh.
So
wow.
you heard the audio?
Yes.
And the feedback, the haptic notification as well.
Yes.
And
Yes.
stop.
So that was the emergency stop.
Yeah, I
you're
covered- I
you're
covered the
about to
cameras.
walk into
I
something.
cover the cameras. Yeah.
I mean, anytime that any of the cameras do not satisfy the safety requirements in a couple of 100 milliseconds, it will give you emergency stop.
That is very impressive. I've got to say the feedback and the response time is really good.
You could run with it, but let's not do that today. 'Cause
No,
you need a few
I don't
hours
run
of
anyway.
training. You need a few hours of training.
That's very impressive. Thank you so much.
Our pleasure.
Perfect.
So there you go, another cool piece of tech here at the Zero Project Conference in Vienna. More of that to come here on YouTube and, of course, daily on the Double Tap podcast and on Access Tech Live, which you can find on accesstechlive.com, on YouTube, on AMI Plus, on AMI TV, anywhere you can think of, that's where you'll find us. And we will, of course, be back here on YouTube again soon. Again, from the Zero Project Conference in Vienna.